This is To the Point with Michael Williams.
Good morning. COVID-19 and turning the corner. Fresh optimism as more and more Americans are vaccinated and trend lines remain positive in many respects. Restrictions on mask wearing for the fully vaccinated being eased. My guest today, an infectious disease specialist. But first, vaccine hesitancy. Millions of Americans are still on the sidelines, unsure or unwilling to get a vaccine. That includes, in some cases, often underserved communities. Tori Dunnan examines that issue in Palm Beach County and begins with the recent pause, since ended, for the Johnson & Johnson vaccine that gave some their own reasons to wait.
It's an issue that the T. Leroy Jefferson Medical Society is taking on. The group of healthcare professionals focuses on underserved communities in Palm Beach County.
Especially since Johnson & Johnson, we've got to, make up a little ground, because I think we lost a little ground on, some of our outreach efforts and things like that around the vaccine with people of color.
Outreach efforts now amped up to deliver a simple message. The vaccine is safe and effective.
I ran into a 13-year-old who told me that her family was afraid to get the vaccine because they thought they would die if they got the vaccine. And so we're trying to change that messaging.
Public service announcements, bus wraps, word of mouth targeting specific family members.
We have programming specifically targeting moms who are pregnant right now, but just in general, we find that moms are doing the shopping in families, and then also they help make those health decisions, and they're the ones who will say, hey, you need to go to the doctor to dad or the kids. So they really hold a lot of power in the family.
They believe there's also power.
And I had to say my goodbyes over FaceTime to my father.
In personal stories.
I don't think I necessarily understood all the way how serious it could get.
22-year-old Terrell Seabrooks from West Palm Beach now works with T. Leroy Jefferson Medical Society to share his story.
Those percentages that we hear about, and we talk about how rare it is, it became a reality for me on August 26th when I lost my father to complications with COVID.
Turning pain into purpose.
One of the happiest days of my life was followed immediately by one of the hardest days of my life. The last conversation I had with my father, the last real one I had before he was admitted to the hospital, was to tell him that I had been accepted into law school.
Now, before he heads off to Harvard Law, he's spreading a message of love through vaccination.
The impact that it can have on a family is devastating, so it's about really helping our community understand that getting the vaccine is necessary, and he definitely would have wanted me to speak out about this issue, and he definitely would be proud, I hope, of the work that I'm doing as well. I know he was proud, when he was here.
Canvassing is a big part of this campaign. That's where Malcolm, who lives in Riviera Beach, comes into play. Malcolm is a canvasser. What are you out here doing today?
Well, basically, we're going door to door, knocking on doors to make sure, urging people to stay safe during COVID, knowing that there's vaccines out, but we still have information as well as some masks and sanitizer to make sure everyone is still safe.
This afternoon, Malcolm says he's going to be hitting this neighborhood here in Riviera Beach.
Well, we handing out this stuff in the community.
All right, thank you, appreciate it.
Do you think this is effective?
Yeah, I believe it's very effective. A lot of people in the neighborhood like interaction, face-to-face interaction.
Now to my guest today, Dr. David Dodson, a local infectious disease specialist, a familiar face on To the Point this past year as we've navigated COVID-19. We began by talking about vaccine hesitancy.
So yeah, vaccine hesitancy, in some ways it's a uniquely American phenomenon. Most of the world is hungering for vaccines, and there's been about 400 million people in the world that have received at least one dose so far. In America, we're up to about 35% of our population fully vaccinated, 46% have received at least one dose. And yet there is a group of people who are hesitant to get a vaccine. And so the low-hanging fruit, all the people who wanted vaccines, those have been accomplished. We've just learned that Pfizer has gained approval to vaccinate 12 to 15-year-old, and soon we'll be vaccinating more kids. But yet there's a small number of people that refuse to get vaccinated. And we're starting to look into why that is. Because there's various reasons, but and in order to approach this, you have to dissect which reasons are applied to which people. So I've seen some people are worried about whether the vaccine is effective, It is 95%, very strong efficacy, and we're seeing declining deaths and hospitalization. Some people worry about whether it's safe, whether there's going to be problems with the vaccine. And then some people worry about side effects. So the side effects, yes, some vaccines do have side effects. People can feel achy or have a fever or something like that. But the side effects of the vaccine are much better than getting COVID. And then there are also some, as we start diving deeper into this, there are conspiracy theories like the vaccine will make you infertile, or
Speak to that. We've heard that. That's absolutely not the case.
Absolutely not the case. How on earth could anybody know for a vaccine that has been around for 6 months, or at least been widely vaccinated for 6 months or 9 months? How could we know that it would make people infertile? It's impossible to know that. But yet whoever put that out on the internet, I've heard one doctor say, shame on them. It's absolutely wrong.
Doctor, I want to be clear though. You're saying, how can we know? I want to be clear. There's absolutely no evidence that this vaccine would make somebody infertile. Is that correct?
Absolutely none. And there's no scientific basis to even think that it would.
And then also someone said it'll change my DNA.
Same thing. The vaccines are just a little piece of mRNA that stimulate your body to make antibodies. So it is not a whole virus. It is not DNA. It is not going to be inserted in DNA. So it's medically impossible to alter your DNA.
Some numbers said about more than 150 million people. I'm looking at the numbers. About 58% of all adults have received at least one dose, according to the Centers for Disease Control and Prevention. Good, but we need to do better. Why?
Yeah, so, step back and look where we are in the pandemic. And I'd say we're probably getting into the 7th inning of the ball game here. So we've had these remarkable vaccines come on board. There's been an incredible push to get everybody vaccinated. We're getting our numbers up, but we have to reach that herd immunity. And to get there from where we are right now, we're going to have to vaccinate the kids, which are about 20% of the population. And then we're going to have to reach people who are hesitant to have the vaccine. And that's going to require community leaders going into their communities, almost going door to door, neighbor to neighbor, to find out why people are hesitant. And some people are hesitant just because that's what they believe. But there are some people that are kind of in the middle group that just can't, they can't make it off their job, or they have difficulty with access. And those people have to be reached to get vaccinated.
And in fact, we saw that in Tori Dunnan's piece, canvassing the neighborhood, talking to people. What would be your message to somebody who said directly to you, doctor, I hear everything, but for a variety of reasons, I'm still just hesitant. As you sat and looked them eye to eye, what would you say to comfort them and say it's something important to do?
Well, what we've learned is that you can't shame people or lay a guilt trip on them. That just won't work. They'll dig in their heels. So you ask why exactly are you hesitant? What have you heard? And then let's talk about it. And it's really, I'd emphasize that it's as much about our country as it is about you. So there is a national responsibility for us to all get vaccinated. And 150 million people in the United States, 400 million people in the world have been vaccinated. So why are you dragging your heels?
The Johnson & Johnson vaccine put a scare in some people. There were a very, very small number of cases where blood clots had occurred. Sad, but nonetheless, a very, very small number. Do you think we're beyond those concerns? The efficacy of the vaccines largely is something that we can all be confident of, and have been for really many months, largely so.
Yeah, you have to weigh the minuscule risks from the vaccine versus the risks of COVID. And people die from COVID. So the blood clot issue it's rare, and it's not something that should prevent people from getting a vaccination.
And doctor, you talked earlier, and I want to go a little more in depth. We're talking about the inoculation campaign for children ages 12 to 15, Pfizer vaccine available to them, 17 million children in the US. Again, there will be some parents who will say they're all in, others will be hesitant about that. That's the next big phase, though. Talk about it, concerns surrounding it, and moving forward, your prescription to people worried.
Right. So we're getting, a little over half our population been vaccinated. If we want to get to 70 or 80%, we have to bring in the children and we have to bring in some of the people who have been hesitant. So that's where the door-to-door campaigns will help. And then getting approval for kids getting vaccinated, that'll get us all to where we need to be as far as herd immunity. And what we're hearing from the CDC is that once you've been fully vaccinated, then a lot of these restrictions can fall away. We don't have to wear masks when we're all vaccinated together. And we can stop doing some of these things that we've had to do in unvaccinated settings.
What's at risk if we see the numbers really taper off and not climb much more in terms of getting substantially more Americans? Already a lot have been vaccinated, but many still on the sidelines. If we don't get there, what do we risk?
Well, remember World War II. We had a common foe and everybody pitched in together. It's the same thing right now. We have a common foe. And what'll happen is if we don't eliminate this virus, then we're going to be dealing with a low-grade chronic illness for many, many years. So it's our chance to get rid of this thing.
And Dr. Dodson, as always, appreciate your perspective. Other countries, we talk about the USA, we hear about India, we hear about other places. It's vital that this vaccination campaign goes into really high gear all over the world, or we can face the same kind of problems coming back to our shores. That's
absolutely true. We all live on one planet. We're all human beings. And this virus is infecting, it's 160 million people in the world so far. That's probably an underestimate. So what we've learned is that all human beings on this planet have a shared destiny, and it's going to take collective action and national cohesion to get past this. We have to rebuild trust in our institutions and also in science. And we all have to remember that we're all going to do better. We'll each do better when we all do better.
Up next, COVID in politics and online sports betting in Florida. Our roundtable next.